Hi, my name is H.Cabrera, and this is Atrial Fibrillations. So, what are atrial fibrillations? They're also known as AFib, and it's when an individual has an arrhythmia which may lead to a stroke, a blood clot, or, in some cases, even heart failure. These types of AFibs are as listed. Paroxysmal AFib may or may not have symptoms. They can come and go on their own, but it usually stops within seconds, minutes, or up to 1 week, and they can reoccur. Persistent AFibs can last longer than 7 days and require medical treatment. Long-standing persistent AFibs is constant and lasts longer than 12 months and is challenging to treat. Permanent AFibs is exactly what it sounds like. It's just your heart rhythm continuously in AFib. The signs and symptoms may not always occur for everyone. However, if they do, they can include hypotension, shortness of breath or dyspnea, usually when lying down or when exercising, pain or discomfort in the chest, dizziness and fainting, fatigue, or your heart just skipping a beat, fluttering, or beating too fast or hard. How it works. Atrial fibrillation occurs when there are changes in the heart tissue or the electrical signaling which helps the heart to beat. What happens is abnormal electrical signals in the upper chambers of the heart disrupt the normal heartbeat. This causes the atria to beat fast and irregularly. Then, because the upper and the lower chambers no longer work together, the heart can't pump blood efficiently. Now, for the treatment, having a physically active lifestyle, having a balanced meal every day, avoiding smoking and alcohol consumption can be used as treatment, but they also lower your risk of AFib. And then medications like beta blockers, anticoagulants, calcium channel blockers, and other heart rhythm medications in combination with electrocardioversion are common to use for AFib. And then procedures like pacemakers, catheter ablations, electrical cardioversion, like I said earlier, maze procedure surgery, and plugging, closing, or cutting off the left atrial appendage are also used for AFib treatment. Now, the prevalence and incidence. The most recent numbers were reported in September of 2024 on just how many people were affected by atrial fibrillation, which was found to be around 10.5 million individuals. In the US, the most common trends found were that patients of AFib were beginning to get younger and younger, they were less likely to be female, and they more than likely had a previous underlying condition such as hypertension or diabetes. Another trend found was that AFib-related deaths had increased overall, but these studies have overall played a crucial role in informing us about the importance of early detection and treatment. Now, the mortality rates. When looking at the age-specific rates of mortality from the years 1999 to 2024, the death rate totaled 1,307,809 AFib-related deaths. As you can see in the data depicted by the NIH in this chart, they listed the different age ranges on the left column with the number of deaths that correspond to that age range in the right column. We can immediately see that those who are 85 years and older have the highest death rate with 716,683 deaths. That makes up over half of the atrial fibrillation related deaths. 54.8% of them, to be exact. These were likely the result of an AFib-related stroke or heart failure. The death rates, according to this chart, grow as people age, so we can conclude that the younger a person is, the less likely they are to suffer an AFib-related death. The demographics. The most recent data I could find on demographics were these maps on the right, which show the darker shaded countries as having higher rates of incidence related to AFibs. The maps on the right clearly depict this and show us that in 2021, AFib incidences were most common in North America, Australasia, and Western Europe. The highest incidence and occurrence seen since 1990 was actually in the United Arab Emirates, Qatar, and Jordan. So, who's most affected? Well, atrial fibrillation actually has more specifically affected groups than just age, such as the highest affected group by race are actually white adults, with men being more affected than women. There's also a lower lifetime risk for African American adults. And, as we saw in previous charts and multiple slides, atrial fibrillation becomes more and more prevalent the older an individual gets. Those with higher income and education had a lower risk of AFib, but eventually they went on to develop a higher risk of AFib because they also live longer, and as we know, the older a person is, the more likely they are to develop atrial fibrillations. In the next few slides, I'll be explaining my intervention plan. If we look at the map on the right, which is an image from a study tracking cardiac dysrhythmia hospitalization rates from 2018 to 2020, we can see the higher prevalence of AFibs represented as the darker red areas on the map of the US. And this is where the target and location comes in. The dark red areas included states like Georgia, Alabama, Kentucky, Ohio, and Florida. For my intervention plan, which is backed by research, I plan to be focusing on Florida, as it does generally have a larger population of elderly and retirement age individuals, who, as we know, are at higher risk for AFibs. Now, my proposed plan. My main goal for the Florida area would be to ensure the community is offered education on risk factors and shown screening tools and methods. For my first step, I would have to start in a more densely populated area so that I could begin partnering up with PCPs and community centers in the area. Secondly, I would want to develop a set protocol for atrial fibrillation screenings, especially for those at higher risk. Lastly, I would like to begin launching education hubs for any community members interested and hold mandatory trainings for PCP staff, which would keep them informed on the latest screening and anticoagulation protocols for AFibs. This is all in an effort to decrease the prevalence and or the risk of atrial fibrillations among them. Possible obstacles and solutions. There are some obstacles I've identified, including having a hard time finding community partnerships and ideally some sponsors. Having little to no community participation due to disinterest or a lack of importance to those not directly affected would also be an obstacle. There may also be some pushback from local hospitals on implementing screenings and their comfort with providing screenings. However, I do believe there are multiple solutions that could be effective. A couple include providing hospitals or community centers with material that is simple and assuring to them that the screening process can be simple and fast. It would also be good to offer quick training sessions, both online and in person, to centers or communities in general who would benefit from the training. Lastly, we could always provide some sort of incentive to help persuade them. The most important goal for me here is to reassure participants that there will always be a support to help guide them and lean on, and that if there's ever any discomfort or misinformation, they can easily refer to a specialist. Measuring success. To see my plan as successful would mean seeing less hospitalizations for atrial fibrillation, obviously, as well as seeing more patients with controlled blood pressure. A high completion of the education program that was implemented, and possibly giving patients a survey towards the end of their treatment, to see if they feel confident in managing their medications and lifestyle properly would both be great signs of success in my plan. I believe that any or all of these factors would provide me a solid confirmation that my proposed plan was effective and that my goals were met while helping those in need of it. These are my references, as well as these. And that is all. Thank you for your time.